hello to everyone in the Amy Wall Spa Love chat room. My name is Stephen McGee. I am the president of NeoGenesis, and I am very excited today to bring forward to you two people that you've already had the chance to listen to, Dr. Greg McGuire and Miss Pam Vendetti. But I first just want to give a big shout out and a big thanks to Amy. I've known Amy for probably 4 years now. We've done several projects together. I think the world of you, Amy. And I was so excited that you created this chat room all about the positives, attracting good people. And so far, we've met many good people from this chat room. So from the bottom of my heart, thank you so very much for the efforts that you put into this and that you put in on an ongoing basis. I'd like to tell you all that we're going to share some more insights with you, where we're going to build on the 2 live Facebook chats that we did so far in the Amy Wall chat room. Greg talked about some basic questions surrounding stem cell science, and then Pam talked about a couple of protocols. Those live Facebook recordings are still available in the event section within Amy's chat room, so I really invite you guys to go back and visit those if you have not. Today we're going to talk a little bit more about the science with Dr. Greg McGuire, and then Pam Vendetti, our lead esthetician, lead educator, is going to talk a bit more about some additional protocols. And then I'm going to tell you a bit more about who we are and how we want to be here for you and your patients and your clients. And then our hope is, as a result of today's webinar, you'll give us a call because we really want to hear your story. That's where we're most excited. We've heard some great stories already, and looking forward to getting to know even more of you. So without further ado, I'd like to hand it over to Dr. Greg McGuire.
Thank you, Steve, and a big thanks to Amy for the opportunity here this morning to share our information with her group. Thank you all for joining. And as I pull up the PowerPoint here, I'll just say this journey to create this new technology at NeoGenesis started some 20 years ago when I was professor at the University of California, San Diego. We had discovered that stem cells, in our case, the laboratory that I was directing, was looking at the regeneration of the brain, various neurodegenerative diseases. And we discovered that the stem cells in the brain were repairing neural tissue by releasing molecules, a whole host of different proteins and other molecules. And then we realized this technology could be used with a different set of molecules from a different set of cells to heal the skin. And that was the origins of the NeoGenesis technology about 15 years ago. And we've been working on understanding and improving the technology ever since. So today I do want to give you just a brief introduction about the science and technology underlying the so-called Escort RN technology that NeoGenesis uses in all of our products. So the Escort RN, SRM stands for stem cell released molecules. These are the very molecules that the stem cells make and release to maintain and heal our tissues, including our skin. And the squared stands for the fact that in any tissue, there's more than one stem cell type underlying the maintenance and healing effects, each stem cell releasing its own set of molecules. And so hence the 2, the Escort RM, again, the 2 standing for multiple types of stem cells in any tissue, healing and maintaining the cells and therefore the tissues. So let me talk a little bit about the different stem cell types. I think most of you, probably all of you, have heard about embryonic stem cells versus adult stem cells. Embryonic stem cells there on the left side, that picture, the green represents the colorization of embryonic stem cells. So these are a cluster of embryonic stem cells in a fertilized egg. This happens to be about 5 days post-fertilization of the egg. This little egg here fits on the top of a pin, a PIN. And this is what is responsible for developing us as humans. Same thing is used in animals as they develop, that these embryonic stem cells eventually turn into all the different cells of our body, create the tissues and the whole human being. And these stem cells responsible for our development really act by dividing themselves. They multiply themselves, and then they do what we call differentiation. That is, the embryonic stem cells differentiate, turn into, transform themselves into the mature cell types, whether it's a brain cell, liver cell, skin cell, what have you. So that's what really embryonic stem cells are about. They're about developing us. Now, those embryonic stem cells will mature, and they will eventually turn into somatic cells like a neuron or various epithelial cells in the skin or elsewhere. But the embryonic stem cells will also eventually turn themselves into adult stem cells. And these adult stem cells are located throughout our body. The skin, the brain, the liver, pretty much everywhere we look, we find multiple types of adult stem cells underlying the maintenance and the healing of that tissue. And these adult stem cells mainly act not through differentiation, but through the secretion of a multitude of different types of molecules. That's really what's maintaining us, healing us. These stem cells releasing a lot of different types of molecules. And we'll go into this a little bit more in just a second here. What I'd like to also tell you, because there are other companies out there claiming to use these various technologies, you've heard about other technologies, and just so we're all on the same page and there's no confusion about what NeoGenesis does, we don't use the embryonic stem cells because they don't produce the right set of molecules to heal and maintain our skin. And likewise, we don't use induced pluripotent stem cells or the so-called parthenogenetic cells. Now, induced pluripotent stem cells, there's a lot of buzz about these cells. They're very important. There's a lot of research going on with them. But what happens is you take a somatic cell, something like a fibroblast from a person, and you insert a genetic message into that cell. And then that cell will transform into something that's very stem cell-like. So that's an induced pluripotent stem cell. But the induced pluripotent stem cells are riddled with what we call genetic and epigenetic reprogramming errors. So they don't produce really what they normally would if they were a true stem cell. And the other big factor is that these cells do not produce the tissue-specific sets of molecules that we need to maintain and heal our skin. It's more of a one-size-fits-all approach. Hey, here's a stem cell. It has the ability to do a lot of embryonic-like functions, turn into other cells. But you know what? If you use this to generate molecules for skin maintenance and repair, the right set of molecules just haven't been made. That's the same for the parthenogenetic cell. It suffers from the same problems. It has genetic and epigenetic reprogramming errors, and it doesn't produce those tissue-specific sets of molecules that we need to maintain and heal our skin. So we don't use these cell types. We're using various types of adult stem cells from the human skin. So here's the basis of this technology. You look at these damaged tissue represented by the cells up there, the round circles in blue. If the tissue is damaged, it will liberate certain molecules that are basically damage signals, and those damage signals are recognized by the various stem cell types resident in the skin, and that will activate those damage molecules, signaling molecules will activate the stem cells. The stem cells will activate, mobilize, move close into the damaged tissue, and then begin to release their particular set of molecules into the damaged tissue to start the healing process. Now, as you see here, there's stem cell type 1, 2, and 3. So they work together in unison. It's like a symphony. One of the stem cell types to repair the damaged skin is actually secreting the building blocks for the skin, things like the collagens, the different types of collagens, the laminins, and other building block molecules, so that the bricks are there to rebuild the wall. The other type, like the stem cell type 2 represented there, is liberating instruction sets. Those would be, if you will, the architecture molecules, telling the bricks how they need to be laid in to rebuild that wall, that skin. And likewise, there are other stem cell types resident in the tissue. And since a lot of things have been damaged in the tissue, stem cell type 3 can liberate molecules that actually go in and either repair the damaged proteins from the injury, or the fact that the skin is turning over constantly and maintaining itself. Through that process, there's a significant damage. Some of the proteins will be damaged, and stem cell type 3 will liberate proteins that fix proteins. These will be like chaperone proteins, heat shock proteins, and then if some of those proteins are beyond repair, that stem cell type 3 would be releasing protein conglomerates called proteasomes, which go in and actually surround the damaged protein, surround it, and take it into an area of the cell where eventually that damaged protein will be eliminated from the body. So really what we're talking about here is a lot of different stem cell types releasing a lot of different types of molecules to maintain and heal our skin. So this is exactly what we do with the Escort RN technology. We have gone in and identified, the different stem cell types in the skin. What is their function? What are they doing to maintain and heal the skin? And then we created a biomimetic product. The Escort RN products from NeoGenesis are what we call biomimetics, because we are mimicking the very processes that the skin uses to maintain and heal itself. So again, the key here is multiple factors from multiple stem cell types, instituting a concert of effects, a systems therapeutic, where lots of different molecules are used to hit lots of different targets to institute the full repair of the skin. And that's what we call a systems therapeutic. Important to all of this as well is that these molecules are packaged into a very clever, naturally produced device that Mother Nature makes for us through these adult stem cells. This is called the exosome. The exosome is actually, it's about an 80 nanometer in diameter nanosphere. And it's like a liposome. I know you all know about liposomes, but this is a smart liposome naturally produced by the stem cells. Like the liposome, it's a nanoparticle. It's packaging the molecules to protect them. It is a delivery device, but it is a smart delivery device because unlike the liposome, there are all these other molecules tethered onto or sticking through the membrane of the exosome, transmembrane proteins, tethered polysaccharides, tethered proteins on the outside of the exosome. This imparts a very smart quality to the exosome so that the exosome can penetrate through barriers, target specific damaged tissues, and then deliver the contents of the exosome with all those beautiful molecules, those growth factors, those antioxidants, those proteasomes, those heat shock proteins. All of those will be delivered to the damaged tissue. And interestingly, because all of those molecules are packaged into the exosome, all of those molecules are going to hit the target at the same time. So instead of one molecule going this way and another molecule going that way, one going at time one, one going at time two, all the molecules arrived at the damaged tissue at one time, all together. And so that enables a very synergistic effect where everything is happening from these molecules all at once. Very, very powerful technology. And you have to use the stem cells in the laboratory in a very special way, that is, culture and stimulate them very carefully. It's more time consuming, it's more expensive to do this, to create our technology. But if you allow the stem cells to fully process the molecules, release the molecules in the exosomes, then you have a very powerful, complete technology that's packaged in a natural delivery system that can penetrate through barriers and deliver the molecules to very specific damage targets. Very powerful. So this technology, as I said, originally was developed for central nervous system tissue. We later realized it could be very useful for the skin. We started working with damaged skin, with diabetic ulcers, burn victims, traumatized tissue. Saw very good results there, and then began to also take the technology to making products for topical application for not only anti-aging, but if you go to our website, you'll see that we really are useful to a lot of other indications for the skin, and a technology that is very useful in the esthetician's practice. And Pam will talk about that in just a few minutes. So what we're really doing with our technology is introducing homeostasis. That is, when we were very young, the skin was very supple. It would really heal if it was damaged very quickly, and it would do so without scarring. You all remember when you were 2, 3, 4, 5 years old, where you've been around young people, you've been around babies. That skin is soft, it's supple. It actually has a beautiful smell to it. It's just really remarkable young healing tissue. And that's because in the young tissue, all of these molecules that we're talking about are present there in the right quantity and in the right quality. Those molecules are being made perfectly, and that they're in the right quantity to institute this homeostasis. So as we age, what happens? Well, stem cell function starts coming down. So actually some of the cells may decrease in number. We know that some probably don't, but some of the stem cells probably do decrease in number. But something we recognize for all of the cells in the skin and elsewhere, as we age, as we go through disease states, times of stress, all of this leads to a potential decrease in stem cell function. And certainly aging has a big consequence on reducing stem cell function. So what we're doing in our case is, if you're aged, if you have damaged tissue, the skin is now all of a sudden sagging, you have lines and wrinkles, or discolorization. What we're doing is using these very complete sets of skin-derived molecules, the stem cell release molecules, and we're putting them back into your skin to bring that function back to normal, to recreate that more youthful, healthy state in the skin. So it's reinstituting homeostasis, is what we call homeostatic renormalization. You're just really renormalizing the aged and or damaged skin. That's the basis of our technology. It's using those molecules that were in you when you were young and healthy. There's nothing foreign about this. These are the very molecules that your skin needs to be very, very youthful, very healthy, and therefore, something really beautiful. So it's all about maintaining health, and healthy skin is beautiful skin. A couple of quick results I wanted to show you just with the topical application of the Escort RN technology. The patient in the top panel, topical application of the Escort RN technology twice a day. And you can really see over time the benefit of this technology, just constantly bringing back the health of that skin, bringing back the normal homeostasis of the skin. That is putting back all those needed molecules into the skin. And you can see here, you all understand about the matrix, the extracellular matrix of the skin. And that's exactly, a main function that this technology does. It rebuilds the matrix, and you see the visible reflection of that in these pictures. That matrix is beautifully rebuilt. Blood flow is coming back in. just a host of different functions being restored to the skin when you simply topically apply this technology. Patient at the bottom was about a 60-year-old cancer patient going through cancer treatment, and that very stressful cancer treatment really damaged her matrix, really damaged the skin. You can see in just 10 days of topical application twice a day of the technology that, again, that matrix, that skin is rebuilding, lines and wrinkles are disappearing, skin is becoming taut again. Really, you can see the tone of the skin and the sort of the radiance of the skin returning after the, just in this case, 10 days. And with continued treatment, the skin continues to improve. Likewise, if we think about the hair follicle is loaded with stem cell types. It sits in a bed of skin, and that skin bed that it sits in, the hair follicle, is also loaded with stem cell types. And the stem cell types in the skin and in the follicle work to constantly recycle the hair. And so what we do with our hair technology is to put back into the follicle and the surrounding skin the molecules from the stem cells that are there to enable the better growth and pigmentation of the hair. So this is in a patient who was using, again, topical application of our Escort RN hair technology. And to make you understand here that the Escort RN technology for the hair product is different from the Escort RN technology for the skin product. Because what we have is, in the hair product, molecules that enable the follicle and the skin go back to a normal state. Whereas for the skincare products, we're putting in the molecules that are there for the skin alone. So it's two different sets of molecules. There is some overlap in the two, but two distinct sets of molecules. And so you can see, with simple topical application, there was no other modality used on this patient, that hair is thickening and the hair is darkening again. It's a beautiful demonstration of the power of the Escort RN technology. Likewise, if the skin has seen damage and it has scarred, this technology over time can repair scars. So in this case, the patient here on the left, you can see a red circle on her forehead. This was damaged as the result of a laser resurfacing procedure with Fraxel laser, where just too much energy was dialed into the laser for this patient. And so she had this scar on her forehead for about a year. And she came to us and we gave her our Escort RN technology, simple topical application once or twice a day, depending on whether she remembered to apply it. And over time, that scar repaired itself. Again, simple topical application of the Escort RN technology enables this scar to go away over time. So what you're doing is putting back in the molecules, the really nice, beautiful, small collagen fibers that are there in our young, healthy state are being perfused back into the skin to rebuild the tissue in its normal, young, healthy state. Whereas when Mother Nature and the adult tries to heal a scar, what it's doing, it's compromising. It's wanting to close that wound very quickly. It lays in very big collagen fibers. They're randomly packed in, and that's building a scar. The Mother Nature has closed the wound quickly, reinstituted the barrier, preventing infection. But the compromise is it's using very fastly produced large fibers that produce that scar. Whereas when you use the Escort RN technology to heal that scar, you're putting in the beautiful small building bricks, the small collagens, to rebuild that wall in a very fine, closely packed state. And that's what we're doing with the Escort RN technology. Real quick, I just wanted to reemphasize that the Escort RN technology is based on the fact that stem cells in the adult do most of their healing through the release of molecules. That's exactly what we do. There are other companies that use biomolecule technology. They don't use the complete set of molecules that we use. We use the complete set. All the proteins are fully formed and, importantly, packaged into the exosome for that delivery and protection quality that just most of the other companies don't do this. This emphasizes, again, Escort RN technology. It is pools of molecules from multiple types of adult stem cells. The stem cells release the molecules in the exosomes. Other companies will use lysate processing. That means they harshly crush the stem cells and extract the proteins. And in doing so, they damage the proteins, and they've extracted proteins that haven't fully formed and haven't packaged into the exosomes. So it's an incomplete, less efficacious technology. And we told you about the induced pluripotent stem cells, the parthenogenetic cells. These are the cells that have genetic and epigenetic reprogramming errors. They are genetically modified. And these are cells that just simply don't produce the tissue-specific molecules that you need to maintain and heal your skin. The way that the Escort RN technology works is tissue-specific molecules to maintain and heal your skin. I'll give you one quick example of what goes on in life under stressful conditions. Stress, and you've seen it, you saw it in the cancer patient in that lower picture just a few slides ago. She was going through very stressful conditions. That stress, one of the pathways, liberates cortisol into that body, and that cortisol directly damages matrix. So the skin's extracellular matrix is being damaged by cortisol in very stressful conditions. And what builds that matrix? The stem cells, of course. And what stress does to you also. These high levels of stress have been actually shown to inhibit stem cell function. So under very stressful conditions, when you've seen it in yourself or other people, you can see it on your face. You can see the stress. You can see the damage to your tissue. And what's happening is you've got a double whammy going on. The stress through the cortisol has knocked down the extracellular matrix, and also you've inhibited through the stress the ability of the stem cells to rebuild that matrix. So what we're doing in this case, even under very stressful conditions, if you use the Escort RN technology, you can actually go in and rebuild that matrix, make that skin look taut and firm and without the sagging and the lines and wrinkles. So this is part of the basis of how our technology works. And I'll wrap it up with the talk just to lead you into some of the ongoing research by our lab and other labs. Is something that happens throughout the body is that stem cells are rescuing damaged tissue. And one of the ways they do this is through the matrix. So the stem cells will actually communicate through that extracellular matrix that we rebuild with the Escort RN technology. And what they'll do is the stem cells will sense a damaged cell. So if you see, look at the green set of cells, stem cell on the bottom, a damaged cell up on the top, the stem cell through the extracellular matrix is actually sending a tunneling nanotube from itself over to the damaged tissue. It's making a physical connection. And through that tunneling nanotube, that physical connection, the stem cell can send over to the damaged tissue rescue molecules. So these exosomes go along these nanowires. Actually, organelles can be transmitted through these nanotubes. You've heard about mitochondria and how they produce the energy of the body, the ATP. Well, these mitochondria can be sent from the stem cells to the damaged cells to rescue them. So this is part of what's underlying the beautiful Escort RN technology. And part of our current research is to better understand, to better utilize what's going on between the stem cells and the damaged cells that we're rescuing. With that, I really thank you for your attention. This was a very brief introduction to our science and technology. We'll have more webinar opportunities for you where we can dig a little bit deeper into the science and technology. And with this, I'll turn it over to Pam Vendetti. She really isn't Stephen McGee. She is Pam Vendetti. She's an excellent esthetician who's been using the Escort RN technology for some time and really understands how to use this technology in the aesthetic practice. Pam?
Thank you, Greg. That was outstanding. And boy, I love that. I'm really excited whenever I get to talk about this with other estheticians to show you what's possible in your treatment room, what's possible for your clients. And now that you're understanding the science more, I think everyone should take a nice deep breath and release any stress that you might be feeling. That is such a clear picture of how damaging stress is to us, and that that cortisol, abundance of cortisol, is such a bad thing in so many ways. So nice deep breathing, and it's something that you help your clients with every single day. So I'm going to pull up my presentation. Here we go. I'm going to start today talking about acne. Acne is one of those things that no two clients seem to respond the same way. Acne has some things in common, of course, but then each person is unique and individual and will respond differently to the treatments we do. So I'm going to be showing you a treatment that I actually use on a young woman, and I'm going to show you her slides coming up next. She's 24 years old. I wanted to keep this very, very simple on purpose. As you overlook this protocol that I'm going to be sharing with you, you'll notice it's very simple, and you'll probably have your own ideas about other things you could do, other things that you really like to use when you're dealing with acne. But I wanted to keep it very, very simple on purpose and let the power of these products really get in there and start to heal her skin. And to set it up, I will tell you that while this young woman has a healthy diet and a healthy lifestyle, she has to be on medication for some serious medical issues. They're not helping her skin, but for the near future, that's not going away. So we're going to be dealing topically with something, and I think you'll be very impressed with the results that she's getting so far. So what I've done with her, and she's only had one treatment so far, cleanse the skin with your appropriate cleanser for that skin type. And then my second step is an enzyme exfoliation. I love to use enzymes on the skin. They're so gentle. They're just so beneficial. And we can completely control it. So I do an enzyme exfoliation. And then my third step, I like my ultrasonic spatula. You can use that for a very gentle sort of light exfoliation. It's very good for extractions. If you don't use an ultrasonic spatula, feel free to add your extractions in here as needed, client. And then with wipes or a warm towel, we're going to remove any residual debris that's left on the skin from the extractions. It's at this point I apply our Powerhouse Recovery to the face and neck. I think you'll find generally that one pump is enough for the entire face and neck. The good news is for estheticians, we are going to be having that in a large size spray. And it's very efficient and clients love it. It's a very fine mist spray that you're going to be able to cover the face efficiently. That you're going to love. You're going to absolutely love it. And then I move on to an LED protocol. I love LED for acne, for all kinds of things. LED is a wonderful modality to use in the treatment room. So I added in LED for her. I didn't want to add any other type of products. I just want to focus on the power of the NeoGenesis products, and then use other things that you have in your treatment room to help with giving the client a really nice facial as well. So my LED protocol is 30 minutes. After that, I will apply an appropriate mask. In this case, I used a very simple clay-based mask. She has oilier skin, so that was appropriate for her. Depending on the day, as you know, where I live, it can be extremely dry. So a small amount of intensive moisturizer as needed, even for people who tend to be oilier. As we know, they still need hydration in the skin. So intensive moisturizer is a beautiful product with the Escort RN technology, so good for the skin. And then a chemical-free sunscreen. So it's a simple, simple protocol. It's a lovely facial for the client, but it's very results oriented. And I think most of you are like me. You want them to feel good, but you want to do good more than anything and make sure that their skin is healing and repairing and improving. And this really does that. So for this particular client or any client that's dealing with acne issues, in a perfect world, and I say that because we know every client has a different budget or different needs. When you're setting them up, I love to start them after cleansing the skin using a pump of recovery both morning and night, followed by the intensive moisturizer if needed. Not everyone will need that extra moisture, but if they do, intensive moisturizer is a beautiful product. I like to do this until I see some real improvement. So you will see improvement right away, and you'll see that in the next few slides. But anywhere from 10 days to 2 weeks recovery twice a day is a beautiful thing. After that, I like to drop it so that in the morning, I'm going to replace the recovery with our skin serum product. It's still abundant in the Escort RN technology. It's very easy for the clients to use. It has less of the Escort RN molecules than recovery, but it's still beautiful for daily maintenance of the skin. And I continue to use recovery at night. You may find that a client wants to keep that kind of protocol up long term. They're happy to do skin serum in the morning, recovery at night with the intensive moisturizer. If they can do that, by all means, it is a beautiful protocol to follow. Other clients are going to move to skin serum twice a day, and they're going to think of recovery as a boost. Whether it's a healing boost or a beauty boost, however you want to look at that, using recovery 3 to 4 times a week on the skin is going to give any client that extra boost of healing to the skin. So let's get to her pictures. Now, I have to tell you, these aren't the best pictures, and shame on me because I took them. And this is in 20 days. This is the right side of this client. As you can see, her very first picture is September 30th of this year. So this is very, very recent. You can see, even though the color changes a little bit in the photos, you can see that her skin just lacks that healthy tone. Her skin was very clean, but it almost doesn't look clean. And I know you know what I mean by that. Lots of breakouts, especially in the chin and neck area. Again, most likely some of this is coming from the medication that she's on, but that's not going away. So we're going to be treating that. It was after I took this picture that I performed the treatment protocol you just saw on the previous slide. 1 week later is picture number 2. It's exactly 1 week later. Already, her tone is improving. You can see the size of the breakouts has started to really decrease. Her skin took on a healthier glow and tone to it. And the day after this picture was taken, she actually got a compliment on skin for the very first time in her life. So you know how good that feels. And you know how much her stress reduced when that happened. So she's making great progress. And then 2 weeks later, on 10/20, you can see a remarkable, significant difference in the skin. Any breakouts that she is still getting are much smaller. They are healing much faster, and they are healing without leaving any post-inflammatory hyperpigmentation on the skin. So it's just a total win. And what makes this even more beautiful, if you look down here, the home care, this client is using 2 products right now. She is using a cleanser in the morning. In the evening, she is using a cleanser and recovery. It could not be more simple, and it is so effective. She's thrilled with the results. I'm thrilled with the results. And I'm going to be continuing to monitor clients. So I'll have additional pictures, and hopefully I will get better at photography. But I'm going to continue on with additional photos and keep monitoring her. I love this. I could bump this up and I'd probably see even better results. But just think, if your clients, whatever they can do, if they can do a cleanser and recovery, they can look forward to having this type of results. There is nothing remarkable or different about this client that would suggest she would get better results than anyone else. This is the left side. Again, you can see sort of the kind of pale, unhealthy look of the skin, the diffused areas of redness, pigment, the blemishes that she had that were fairly inflamed. 1 week later, this is a great close-up shot. You can already see the texture of the skin, the tone of the skin starting to change. Marked improvement here. And then 2 weeks later, she's smiling bigger here. She likes what's going on. Much better tone, much better texture. You hardly see much of anything in the way of breakouts. So it's a beautiful thing. Again, here we are. We're talking cleanser in the morning, cleanser in the evening with recovery. These kind of results. The client's thrilled. I'm thrilled. And again, you will probably think of areas you would like to maybe add a different treatment, maybe get her in every week for an LED. There are so many things you can do to enhance this. But look at these results with nothing but recovery and one professional treatment. So next, I want to switch gears and talk about collagen induction therapy, or what is also known as microneedling. I know some of you are not able to perform microneedling in your state. Some of you may work for doctors and perform it. Some of you may live in an area where you can do it, but it is a very, very popular treatment for many reasons. It can really produce remarkable results in the skin with anti-aging. So this is a typical protocol that I follow when I'm doing microneedling or when I'm talking to anyone else about microneedling. Cleansing the skin. And of course, you've done your beautiful client consult and you know that this is an appropriate treatment for someone. You'll apply a numbing cream that is going to be necessary to avoid, too much pain or anything. So you apply that, you thoroughly remove after the recommended time. In general, that is approximately 20 minutes. Once I have a very clean surface to the skin, I'm going to apply 1 to 2 pumps of recovery to the face and the neck, or I'm going to use my spray, which is about 4 sprays. Make sure you use this product up around the eyes, around the lips, but also on the lips, so that anyone going through a protocol or a facial with you, especially people who are prone to cold sore activity after any kind of a treatment, this is a beautiful product for cold sores. It will it'll heal them immediately on the first sign of a tingle. So it's a super valuable product for many, many things. And Steve's going to be speaking to some of that in just a bit. Now, I've started doing something that has really increased my results that I love, and that is to use our product Skin Serum as your glide. It works beautifully. I will start with 2-3 pumps of Skin Serum in a tiny bowl, and then whether you're using your gloved finger or you're using a small brush, I will brush on the Skin Serum in small sections, working around the face, doing the needling. It provides a beautiful glide. It isn't sticky. It absorbs deeply into the skin. It's just another layer of beautiful healing and repair and protection for the skin. It is just producing incredible results. So I really like using Skin Serum as a glide. You'll use less than you might imagine in doing this as you're going back over the skin. At this point, I'll gently clean off the skin if necessary with any 4x4s or warm towels, just blotting gently over the client's skin as needed. I like to apply recovery again here. Now, I've talked to some doctors and others who, rather than step 3, applying the recovery first, I like to do that. Some people like to use the Skin Serum to needle that into the skin and then apply recovery afterwards when you have the channels. perfectly fine. That is an excellent way to do it. I tend to use both. I love this product. I really want my clients to get the best possible outcome. I like to apply it twice. You're going to get amazing results applying it before or after or both. At this point, if it's something you like to do in your protocol, some people like to use a sheet mask or a mask to help cool the skin after the procedure. Some people go right to some intensive moisturizer and out the door. So that's going to depend on your protocol and what you like to show to your clients, what you like to do, and who you follow in microneedling as your instructor and guide. So post-care for collagen induction therapy, recovery is great. Use twice a day after this for 7 to 10 days, along with the intensive moisturizer. They do not need to stay on recovery twice a day forever. I love when they can leave my room with recovery and use it at least 7 days, twice a day after this. I think it's a beautiful thing. At that point, they can go back to the skin serum for daily maintenance, either using recovery at night or as a boost 3 to 4 times per week. Most clients, once they've experienced recovery, they don't want to be without it. They'll use it on their kids, they'll use it on their animals, which you can, your dogs and your cats. They'll use it for burns, they'll use it for cuts, abrasions, anything going on. A drug of recovery is so healing to the skin. So not only do they use it on themselves long term, they have it for everyone else, unless they hide it and don't let anybody else have it. This is a client of mine, and I actually wrote a testimonial. Her skin was so overprocessed when she first came to see me, and oftentimes we have our clients bring in the products they're using. She had 2 Ziploc bags, gallon bags full of product. And when I said to her, well, what are you using now, morning and night? And she said, oh, I use them all every day. So literally, when I touched her skin with my fingers, she turned red. So I would not do any microneedling on her immediately. She needed to prepare her skin. And one of the best ways to do that is to start your client on the skin serum and or recovery to get their skin in the best place to actually receive the treatment in a beautiful, healthy way. So this particular client was very compliant, and she did her homework. So when she came back to me, we were able to start CIT for her. Now, why this picture is significant, as you can see, by the way, she's a professional photographer, so even her selfies are good. When she got in her car right after the treatment, you can see the redness. Down here, we're working on some scarring. It's very old scarring. It's very white. You can see that line. It's amazing how much that's starting to blend in with the rest of her skin. And we just thought, let's just try it, right? Let's see what can happen here. A lot of redness here, all over the place. She was warm when she left. Now, this is 20 minutes later when she got home. This is remarkable. Look at the difference in the redness in her throat area where the scar is. You can see a little bit of pink still on her cheeks. There was a little bit on her nose, but she's already healing. This is 20 minutes later on a client that was so overprocessed, I wouldn't touch her skin until she started to heal it. So this is a beautiful thing. It works equally well, whether you're doing microcurrents, if you're doing dermaplaning, applying our products after the dermaplane. There are so many ways to use this, which we'll be covering in upcoming videos and webinars. This is just my own testimonial about the previous client and how excited we were. The first time she did a CIT, I did not have the NeoGenesis products. She stayed red for over 2 days. So now you can see that doing the treatment with the NeoGenesis products, she literally was almost free of redness within 20 minutes. That's a huge, huge difference, and great for the client. I'd like to just give a shout out to one of our resources that we love, that we work with, and it's Minx Mogul. You can find out a lot more information on minxmogul.com and contact them. Minx Mogul does permanent makeup and CIT certification. You can either do these two together, or you can take the CIT certification separately. But if this is something that you're interested in, talk to them. They can work with every state. They're really good with state laws, what's required in the different states. Talk to them if you're interested in this about a certification, so that you can offer this treatment to your clients legally in your state. They're absolutely phenomenal to work with. Great people. I'm just going to flip through real quick protocols here. And again, we'll be talking about this type of thing more in future videos and webinars. I want you to see how simple it is. This is simplified skincare for me. And in the beginning, I wasn't sure I wanted my skincare simplified, to be honest. We all have our heads full of what we've been taught over the years. Well, you need this, and you need this, and you need this, and you need this. And what I'm finding out is you can believe the science. You can simplify your skincare, which is great for your inventory. It reduces that. I always feel like every day a product sits on our shelves, it costs us a bit of money. You simplify for your clients, which not only reduces their costs, but clients are so relieved that they don't need 5 or 6 steps morning and night, that they can actually have a very simple and highly effective skincare routine. So this ticks an awful lot of boxes. So you can see, just beginning aging skin, we're talking about skin serum in the morning with intensive moisturizer, recovery at night. And I do this to get them going for a couple of weeks, and then I switch to recovery as that beauty boost that we talked about. Don't be afraid if clients need that extra hydration. It's very safe and often beneficial to use recovery and a pump of skin serum prior to the intensive moisturizer. When you're looking at someone with that really aging skin, lots of sun damage, rosacea, or inflamed skin, I call those the more advanced skin issues. I'm going to start them on recovery twice a day. And I think that 2 weeks of this is a really good time to evaluate then if they can move on to skin serum using recovery as that boost that we talked about. Very simple protocols. And then I call this the healthy maintenance. It's never too early to start clients on the healthiest, best use of skincare for them. So those clients that come to you with good skin, they haven't really developed signs of aging yet, or they just look fabulous. You're not really seeing sun damage. You're not seeing inflamed skin. The perfect thing is to get them started on these products now with a cleanser, the skin serum after cleansing, and then the intensive moisturizer. Doing that twice a day, it not only will improve the skin they have, but it's going to help literally knock out any damage going on right then. And it's going to keep their skin looking beautiful long term. I wish I'd had these products when I was 30. Seriously. Glad I have them now, but I wish I would have had them then. So thank you. Big thank you to Amy. This spot board reads, when you read the member names, it's like a who's who in the aesthetics world in our country. So it's super exciting to have such a brilliant group of people coming together in one place who are really positive and who are making a difference in the skincare industry. I love that. And I would love to hear from any of you that have additional questions, comments, want to know how you can get started. My email is listed right here, pvendetti@neogenesis.com. I encourage you to check out our website. There's so much good stuff on the website, and Steve is going to be sharing that with you. Our number, thank you for being with me today through these protocols. And now I'm going to turn this over to Steve.
Fantastic. And let me just hop over with my slides for our people here, and should be showing up. So first of all, I just want to let the group know, I know you get this already, but you listen to how Dr. McGuire is able to just take a very complicated discussion and really simplify it. I mean, stem cell research and the history of stem cell science it's remarkable, but to have a PhD research scientist as steeped as Greg is, able to give it to us in more simplistic terms is very helpful. And then Pam, what a great job yet again. I really loved when you talked about the microcurrent and some of the other modalities in your other Facebook live chat. I recommend, again, everybody take advantage of those Facebook live chats as well. And then as Pam and Greg said, I want to just take you on a quick tour. And let me just see if I can move over here. I can see. So on our website, let me just use this to give you guys a little bit of a sense. You can see under conditions that if you highlight over there, you can see all the different ways that we can help serve you and serve your clients and what we refer to as the beauty and the appearance medicine. You're getting insights on protocols that include other modalities and how we complement those modalities, and home protocols that are really incredibly simple. But as Greg and Pam also indicated, there's so many chronic and traumatic conditions that your clients and your patients are contending with today. They might come in under that general guise of anti-aging, but then you find out they've got eczema, they've got psoriasis, there's an outbreak of shingles in the family, there's a cold sore that erupts in another member of the family. So there are so many chronic conditions, and we're oncology safe, and we've got some wonderful products. So I wanted to show you a few pictures. So under the anti-aging, if you were to highlight that, you'd see that people just talk continuously about feeling a difference in the tone in their skin, the suppleness of their skin, glowing skin, and we love those kinds of reviews. But also, you saw Greg speak a little bit to this Fraxel laser surgery, laser treatment, and kind of a byproduct, if you will, that occurred, but being able to help heal that. This picture happens to be down in Australia. It was a doctor's office that was comparing the use of recovery post-Fraxel on just any Fraxel treatment as compared to the leading product down in Australia, New Zealand that they were using. And hands down, no pun intended, recovery outperformed the other series, the other serum. I really like this particular story here. There are two quotes by this young lady. God bless her. She actually reached out to us initially because she had gotten a peel that was performed, and actually her surgeon who had performed a lumpectomy on her had recommended that she get a peel just 2 weeks before she was going to begin radiation. She had just a terrible reaction to the peel, got a hold of us. We were able to settle that pain and that discomfort down immediately with the peel. But then what she went on to do is, on that first quote, she had sent us a picture here on her 9th day of radiation treatment. She followed her esthetician's advice to apply recovery twice a day, initially for the chemical peel healing process, but then to continue to apply it to pre-fortify the skin going into radiation. Day 9, looking good. Week number 6, she sends us a follow-up saying that her doctors are amazed that her skin looks as good as it does after 6 weeks of radiation because this lady has lupus. So it's an amazing story. It's our pleasure to help people like this. We've got a lot of stories like this. Here's another example of somebody that had a bit of a reaction, just a little bit too strong of a peel. But if you just go down, you can see the front here. You can see the right side here, the left side here. She had the peel, had the reaction, put recovery only on the right side of her neck, not the left side of her neck. So within 1 hour, starting to see some real calming when you compare the right side to the left side. 1 day later, here's how she looks on the right side versus the left side. And the area that she did not apply recovery to, we did a little more close up right here, actually was blistering 24 hours later. So the difference between getting out of that discomfort and healing more quickly, we certainly are, we understand the value of peels when they're properly administered, but being able to help people just respond even more quickly by using our products pre-peel procedure and then post-peel procedure, real benefits there. I mentioned before eczema. Here's a lady that for 20 years, she couldn't wear a pair of shorts or a dress. tried everything. She's in this industry, very expert in this industry. 2 months on recovery, and she said for the first time in 20 years, she's able to wear shorts again. And for me personally, it's my pleasure to help bring this science forward. I almost feel like with all these stories that come back to us, it's like, I feel like an angel is kind of touching each of these people on the shoulder to give them some of that health. Here's another example of eczema. This was a young man who had had eczema for 5 years. Within 2 weeks using recovery, here we go once again. So what I mentioned for you is people come in with one reason, one purpose, but they have entire families frequently that you can now help with a myriad of different conditions. Here's a lady that has Addison's disease, so she also heals much more slowly. She shows using, and she also is so unfortunate, she gets multiple shingles episodes each year, and the stories about her just really are moving. Here is 2015 without the use of recovery, and it would take her typically a month to heal from a bout with shingles or even longer. Now she's down to 12 to 15 days in her healing cycle with shingles, much less discomfort. Here's a gentleman, same song, different verse. It was a single episode, but he learned about us just in time. Day 1, he got a hold of us. By day 14, we pretty much had him back, doing a normal lifestyle. This is a form of dermatitis. This poor lady, once again, she had this rash for 5 years, multiple doctors, tried prescriptions, steroids, a lot of different things. Nothing worked. After just 30 days, now you can see what's happening. She said for the first time in many years, she's feeling like she's got skin again, and she's very excited. Her pain has gone down, her itching has gone down. And again, you all know this as well or better than I do. When people have compromised skin, it affects their self-image, it affects their confidence, it affects their ability to get out and participate in life. And so this is where we can all be just helping so many people live better lives. Here's another form of dermatitis. I'm starting to think that dermatitis is almost the name that doctors give it when they can't figure out any other name to give it. So we do a lot of wonderful things with different forms of dermatitis. Here's another young lady that she, for some crazy reason, had a reaction when she got her braces in. It started to cause this reaction in her lips. And these pictures basically are kind of her describing her story. This is day 15, and her issue was it would take her 30 days from when she would have this reaction for her skin on her lips to just slowly peel, and she felt like a lizard with her lips. She even says she cried while she was writing this review when she remembered for how long she was kind of like homebound because she couldn't go anywhere. And she would get through a 30-day cycle, and her lips would finally get healed, and then it would start all over again. A tough case, but 6 months later, using recovery on her lips on a daily basis. If she has one of these issues, it lasts 1 to 2 days, very much quicker healing. The pain is gone, and we're happy to get her back into day-to-day living. Here's an example of wound repair. Nasty gash on the leg here, combination of microneedling plus NeoGenesis recovery. You can see how the leg is looking just a few short months later. Here's another great example of wound repair. This happens to be myself. About a year ago, I had a mountain biking accident. I broke my left arm in 7 places. I broke off the end of my right elbow, had some other lacerations. I thought this is a perfect case study. So I put the recovery on my right elbow, which had the deeper gash. Didn't do anything on my left hand, which was just superficial lacerations. 21 days later, I'm completely healed. But not only the scabbing, the other thing that Dr. McGuire could speak to in a future webinar was I had nerve damage from breaking off the end of my elbow, and it just really seemed to settle that down. And we've noticed that in shingles as well. Very interesting, response compared to my hand, still scabbing 21 days later. I'm a believer for sure. Here's a mechanic. Another use of the product, burned his hands. He does it all the time. So starts with, in this case, the wife using our products. She's got recovery at home. Papa burns his hand. He's able to recover far more quickly, avoid actually losing the skin, get back to work more quickly. So many different uses of the product, and we just continue to discover more all the time. Under our product science section, we've got a consumer section, which has wonderful information that you can share with your clients and your patients. We've got the professional section and the advanced section, which are designed with much more in-depth research and insights for you all. I strongly suggest the video link. There are a number of videos with Dr. McGuire there, where he does a little deeper dive on parts of the science. We'll be continuing to add to that inventory of videos with Pam's videos on treatment protocols and whatnot. And then another part of our website is the About part, which is where we give you an overview of who we are. And we've been speaking to this. The goal is to really reduce the complications of skincare. Give your skin just what it needs, which is what it creates when it's in a healthy state. So we now have this available to us. And what you're seeing is that these products work on so many different conditions. But our mission is what I really want to point out to you. Our goal is to really reach out and help 10 million people with this science. And you can see within many different applications just what we could do for you and your practice with your client base, not only in terms of people that you already give service to, but we have wonderful products that can really help you to secure additional clients. Bring them in, serving them with one condition, and then you're able to help them with so many other aspects of their lives and their family lives, and we're excited to do that with you. So just pulling it all together, if I were to give you the NeoGenesis difference, I would tell you, first and foremost, it's all about our people. I know you picked up the passion with Greg and Pam and myself today. Everyone on the NeoGenesis team has such a sense of mission. We care about everybody. We want to help those people that are in need. And every day we ask ourselves, how many people can we help today? And that's where we get charged up. And when we get the feedback that we do, we just sleep good at night knowing that we have helped as many people as we have and that we're on this journey to help even more. We are the next generation of stem cell science, the use of the multiple stem cells to get that plethora of molecules that Greg talked about. I think when you go back and review this video again, you'll get even more from that. We pool those molecules into those exosomes for that targeted delivery. And my goodness, when I finally really got clear on what Greg was saying there, I was going, that is pretty amazing. And then as Greg said, there's a therapeutic side to our business and with the cosmeceutical side of our business. With just 3 products, look how many different needs and conditions we can help you serve in the treatment room and help you serve with the protocols at home. I know you all know, and you tell your clients 80% of their success with their skin is based on their home protocols. If you can reduce them from 9 steps to 2 or 3 steps in the morning and evening, life is better, better results, less time, it's all good. And I want you to know most important about our commitment to your success. We've got a concierge team where we align a account manager, an educator, and a customer service representative that all get to know you very well. Greg is accessible. It's amazing just how accessible he is and how much he enjoys speaking to the science and speaking to different conditions. So he's a part of that team as well. We've got a great deal of marketing support that we'll tell you about in a follow-up call. Tremendous product and sales training. Our goal is to build a great business with you. And then with some of you that have more of that charitable, philanthropic bent to you, maybe you're serving oncology patients and you're serving them for free because they're financially decimated. We want to work with you in contributing our products to some of those patients that need our products but can't afford them. So our goal is to build great businesses with each of you, and with those that really want to, we want to also step into the community and do great things to give back. And we invite you guys to join us on that, and we really look forward to actually joining you on your journey. So once again, Pam's available for you. I'm available for you. You've got our main office line number as well. Whoever sent you this link, chat with them a little bit further. Give us a call to learn more about some of our special offers for the Spa Love chat room. And I just want to say one more time to Amy, thank you, Amy, for everything that you have done to put this room together and bring all these wonderful people together. We've really enjoyed the folks we've met so far, and we look forward to meeting more of you in the future. With that, on behalf of the NeoGenesis team, we all say thank you and have a good day.
Thank you.